very important in these last few days before Monday night. We get as many of our neighbors, our friends, folks we go to church with to know about this opportunity. It's a special opportunity to get health coverage that's affordable, and we're going to hear a little bit about how important that is to families all across Illinois. I walked across our state 13 years ago. I started at the Mississippi River in Rock Island. I was with my doctor, Quentin Young, and we walked all the way to Lake Michigan in Chicago on behalf of decent health care for everybody. And that's what this is all about. Get Covered Illinois is making sure we get everybody in Illinois an opportunity to have health coverage. There's no more important thing to a family than to have good health and to prevent bad things from happening. That's why we don't want any of our neighbors, our relatives, our friends, our coworkers to go without health coverage. And we want to promote this as much as we can in these last few days. We have our van that's been all over Illinois. Get Covered Illinois. We know how to do it. We know how to organize. We're people who come together and help our neighbor. And no better way to help your neighbor than to make sure that that person has access to health care coverage that's affordable. And it was just said, since we began this movement, and it is a movement, we've been able to get 1/3 people in Illinois with health care coverage that they didn't have a year ago. That's a great achievement. That's what people do together. We know how to organize. We know how to make things happen. We want to make sure that our movement to get folks health care coverage, it bubbles up from the grassroots. And I want to thank all the people who are involved in this movement. It is a very special movement that'll really make our state a better state because we'll have more people with health care coverage. And I want to bring forward someone now who's working, and his shift is 7 o'clock tonight, I think, or he's going to work till midnight, isn't that right? To midnight, and he's on the phone, because we have our navigators at our call centers that can answer questions of anybody about this issue in order to make sure we get in the door, get in by the deadline.
Hello, my name is Christopher Jackson. I work for the Get Covered Illinois Help Desk. I got the job through the Chicago Lighthouse for the blind and people who are visually impaired. It has been a great opportunity to explain to people about how to get covered in Illinois. It has allowed me to help people who don't have insurance and to help the youth and to help youth get insurance and explain to people how things are. I'm a person with euthanized glaucoma, and I have insurance, and I've had surgery. I've had 4 surgeries within the past year. So without health insurance, I myself would have been out of the thousands and thousands of dollars.
I'm Keith. I lost my job as a teacher in 2010. My wife, Joyce, who's here with me today, lost her daycare job in 2011. And with that, we lost our family health care and family insurance. The COBRA was absolutely ridiculous. They wanted us to pay $2,000 a month for the same coverage we had before, and we just had to turn it down because we were unemployed. Also, Joyce had 2 pre-existing conditions that wouldn't let us get private insurance. She had thyroid condition and she had a West Nile. So we found ourselves without family health care or insurance for 2 years. For 2 solid years, we went without health care for our family. Now, I would like to ask anyone to come to me and tell me what it feels like to not cover their family health care for 2 years. I want to know what it feels like when I take my son, Scott, into the emergency room with a sports-related injury, knowing when I walk into that emergency room, I have no health care. I'd like the people that oppose this to talk to me and tell me how they would feel in the same situation. That should not be the case. No one should ever have to go through that, especially in this country today. No one should have to experience that. We opened an application on November 14th. We got our insurance on December 13th. We paid our first premium January 1st, and we've been covered ever since. And we want to thank the ACA. We want to thank the people that have worked to put this in place. My other son, Eric, is also covered through ACA. He is a millennial. He's invincible, he thinks, but now he has affordable health care and is as happy as a clam.
Hi, I'm Eric. I'm 26, and I guess I'm invincible. I did one of those marathons where you run through the mud and stuff, and I got sick, and I had to go to the emergency room, and I ended up walking out with, $2,000 in hospital bills, and I have no health insurance, but now I have health insurance, and I can run a million marathons if I wanted to, and it feels great, and I am so thankful everyone is here to get this passed and keep it here, and everyone's fighting for this, and it's great. Everyone get covered.
Hi, I'm Scott. I'm glad I'm covered. I can finally play baseball and football and rugby and everything I do without being scared I'm going to injure myself. I'm finally glad I can go out and have fun and not be worried about anything. I'm covered.
All right, Scott, good man.